Hello, this is Pakinem Salim from Negative Team discussing whether we should mandate genetic testing on certain populations in Africa to enhance the healthcare services. I'd like to welcome everyone today to today's discussion on the topic. And our focus is on the complex and multifaceted debate over whether African governments should mandate genetic testing for specific populations or not. I represent the negative team. Genetic testing holds significant promise for improving public health outcomes. By identifying genetic predispositions to certain diseases, we can tailor healthcare interventions more effectively. However, the idea of mandating such tests is not without its challenges. While the intention behind mandatory genetic testing might be to enhance health outcomes and manage diseases more efficiently, we need to consider the ethical, social, and practical concerns that arise. For instance, there are questions about privacy, consent, and the potential for genetic discrimination. Governments around the world are exploring various strategies to address widespread and hereditary diseases. In Africa, where there's a rich diversity of genetic backgrounds and significant health challenges, the idea of mandatory genetic testing could theoretically offer a path to more targeted healthcare interventions. However, implementing mandatory genetic testing is fraught with ethical dilemmas. We must consider the implications for individual rights and the potential for misuse of genetic information. Additionally, there are practical concerns about the infrastructure and resources needed to carry out such widespread testing. So we need to balance the promise of improved health outcomes with the ethical, social, and practical concerns because it's a crucial matter. As we move forward, it's essential to engage in open dialogue with all stakeholders, including the public healthcare professionals and policymakers, to ensure that any measures taken are both effective and ethically sound. Moving on to the next slide, we will explore the ethical, social, and practical considerations involved in such policies. While mandating genetic testing for specific populations in Africa has the potential to significantly enhance healthcare services, it must be approached with caution. The benefits are clear, but we must be careful. Ethical considerations are paramount. We need to ensure that any policies respect individual rights and promote equitable healthcare outcomes. This means addressing concerns about privacy, consent, and the potential for genetic discrimination. Social implications are also significant. Mandating genetic testing could lead to stigmatization or social exclusion if not handled properly. It's crucial to engage communities and ensure that they understand and support the initiatives. Practical considerations cannot be overlooked. Implementing such policies requires robust infrastructure, resources, and training. We must ensure that the healthcare system can support widespread genetic testing without compromising other services. A balanced approach is essential. Emphasizing voluntary participation, informed consent, and robust data protection can help harness the benefits of genetic testing while mitigating its risks. Also, allowing voluntary participation ensures that individuals have a choice, which is fundamental to respecting their autonomy. Informed consent is critical to ensure that people understand what genetic testing involves and the implications of its results. We need to make sure and communicate that there is a robust data protection to make them feel safe about their genetic information, and also we need to safeguard the genetic information itself and prevent misuse. This builds trust and encourages more people to participate in genetic testing. So I like to augment my point of view by discussing a few points. One of them is mandating genetic testing could be considered some sort of a violation of personal autonomy and privacy. Mandating genetic testing can be seen as a violation of personal autonomy. It forces individuals to undergo medical procedures without their consent, which undermines the fundamental right to make decisions about one's own body and health. This is a significant ethical concern that cannot be overlooked. Also, genetic information is highly sensitive and very personal. Compulsory testing could lead to breaching of this privacy. The genetic data could be misused, or could be data storage could be breached. The risk of such sensitive information falling into the wrong hands or being used for purposes other than what was intended to, this is a serious issue and needs to be addressed. Point number 2, there's a potential of discrimination and stigmatization in the context of mandating genetic testing. Genetic testing can reveal predispositions of certain diseases, which might lead to discrimination in employment and social interactions. This is a significant concern, as individuals could be unfairly treated based on their genetic profiles. Specific populations can be unfairly targeted or stigmatized based on their genetic profiles. This is particularly troubling in the context of historical and social context in many African countries, where instances of ethnic and racial discrimination have been prevalent. Mandating genetic testing could exacerbate these issues, leading to further marginalization of vulnerable groups. In conclusion, while genetic testing has its benefits, mandating it raises substantial concerns about discrimination and stigmatization. We must ensure that any approach to genetic testing is implemented with sensitivity to these issues and includes robust protections against misuse. Point number 3, the ethical and legal concerns. There are significant ethical concerns regarding informed consent and the right to refuse medical interventions. Mandating genetic testing without proper ethical frameworks and legal protections could lead to abuses of power and human rights violations. It's crucial that individuals retain their right to make informed decisions about their own health and medical procedures. The lack of comprehensive legal frameworks to regulate genetic testing and protect individuals' rights in many African countries makes the implementation of such mandates risky and harmful. Without robust legal protections, there is a heightened risk of misuse of genetic information and violations of privacy. Another point I need to bring about is implementing mandatory genetic testing on a large scale presents several practical and logistical challenges. Firstly, it requires substantial resources, including advanced technology, skilled personnel, and robust infrastructure. Many African countries may lack the necessary resources to conduct such programs effectively and ethically. Moreover, ensuring the accuracy and reliability of genetic tests is crucial. Inadequate infrastructure and expertise could lead to errors in testing and also interpretation, resulting in incorrect diagnosis and treatments. This not only undermines the effectiveness of the program, but also poses significant ethical concerns. Also, the African countries, they have large populations, so the probability of error is always higher. Therefore, before considering the implementation of the mandatory genetic testing, it's essential to address these challenges. In the next slides, if I may suggest some strategies that respect individual autonomy, such as voluntary genetic testing programs. We could encourage voluntary genetic testing programs through informed consent. The informed consent, they encourage voluntary participation in genetic testing with comprehensive education on the benefits and risks, ensuring the individuals can make informed decisions. We also promise privacy protection. We should implement robust data protection measures to safeguard individuals' genetic information and build trust in the testing process. We could also make mass education a thing. We should make awareness campaigns Health literacy is really important. It increases public awareness about genetic diseases and the importance of early detection through community outreach, educational campaigns, and partnerships with local organizations. Also, we need to make sure we are not tackling cultural sensitivity. So we should tailor educational materials to be culturally relevant and accessible, addressing specific concerns and misconceptions within different communities. As an example of voluntary testing programs that have been implemented, there's voluntary workplace genomic testing. Some companies in the United States have introduced voluntary genomic testing as part of their workplace wellness programs. These programs offer employees the option to undergo genetic testing to identify potential health risks and receive personalized health recommendations. This approach has been well received as it respects individual choice while promoting health awareness and preventive care. Also, the newborn screening programs. Many countries have voluntary newborn screening programs where parents can choose to have their newborns tested for a range of genetic disorders. These programs have been successful in early detection and treatment of conditions such as phenylketonuria and cystic fibrosis, significantly improving health outcomes. We could also eliminate stigmatization and the cons of mandating genetic testing by research and collaborations. We need to support local research initiatives to understand the genetic basis of diseases prevalent in specific populations and foster homegrown solutions. We can also partner with international organizations and research institutions to share knowledge, resources, and best practices in genetic research and healthcare delivery. As an example of voluntary testing programs that have been implemented, there's voluntary workplace genomic testing. Some companies in the United States have introduced voluntary genomic testing as part of their workplace wellness programs. These programs offer employees the option to undergo genetic testing to identify potential health risks and receive personalized health recommendations. This approach has been well received as it respects individual choice while promoting health awareness and preventive care. Also, the newborn screening programs. Many countries have voluntary newborn screening programs where parents can choose to have their newborns tested for a range of genetic disorders. These programs have been successful in early detection and treatment of conditions such as phenylketonuria and cystic fibrosis, significantly improving health outcomes. Two more examples. One is the direct-to-consumer genetic testing. Companies like 23andMe and Ancestry DNA offer direct-to-consumer genetic testing kits that individuals can purchase voluntarily. These tests provide information on ancestry, genetic traits, and potential health risks. The popularity of these services demonstrates the growing interest and acceptance of voluntary genetic testing. Example number 2, the community-based genetic testing initiatives that could be done. The community-based genetic testing initiatives, like in some regions, community health organizations have launched voluntary genetic testing initiatives to identify carriers of specific genetic conditions prevalent in the community. For instance, the Dor Yeshorim program in Jewish communities offer voluntary genetic testing to prevent hereditary diseases like Tay-Sachs. So, as a closing statement, I'd like to summarize and recap what I said in the above slides, that while genetic testing has the potential to address significant healthcare challenges, mandating it for specific populations in Africa raises profound ethical, social, and practical concerns. It's essential to prioritize individual rights, ensure robust legal and ethical frameworks, and address the potential for discrimination and stigmatization before considering such mandates. A more balanced approach, focusing on voluntary participation and informed consent, would better respect individual autonomy and promote equitable healthcare outcomes. Genetic testing might offer a more balanced path toward enhancing public health without compromising fundamental ethical principles.